Good evening. My name is Jessica Fisher. I'm an RN, and I'm currently working on finishing my bachelor's degree. In this video, I'm going to be talking about the impact of the media's portrayal on the nursing image and its profession. The specific article I'm going to be discussing is The Nursing Profession, Public Image, Self-Concept, and Professional Identity, a discussion. The article was featured in the Journal for Advanced Nursing. So in the article, the authors draw attention to the fact that the media portrayal of nurses, it's still perpetuating the stereotypical doctor's handmaiden or the sexy nurse. In earlier films, we were viewed as self-sacrificing sex objects, basically. We have made some progress. There have been a few shows that are portraying us with having a little bit more self-confidence, or being more self-confident professionals. We're playing a little bit more of an active role, but we're still the physician's subordinate. But we're making progress. We're getting there. As far as how the general public still views us, we're still female only in their mind. They get very surprised when they see a male nurse. We're delicate female creatures instead of being autonomous members of the healthcare team. However, despite these stereotypes, our patients, they've still viewed nursing as one of the most trusted professions and as highly respected professions. One thing that the article touched on within all of this that was actually really intriguing was they talked about the Chinese culture and their healthcare system. With them, the lower status takes care of higher status. Well, what do nurses do? We take care of everyone else. So this is still perpetuating the idea that nurses are lower than a physician. Thankfully, we have made progress over here. But it really wasn't all that long ago that we were viewed very similar to this. If a physician walked into the room, we would have to stand up, we would give up our seat. And if there was something wrong with an order, if we dared question that order, we were met with, well, you're just a nurse. Unfortunately, it still happens, but we're getting so much better. All right, so the ANA Code of Ethics, Provision 5. I'm going to read it so I don't mess it up. The nurse owes the same duties to self as to others, including the responsibility to promote health and safety, preserve wholeness of character, and integrate and maintain competence and continue personal and professional growth. Provision 6. The nurse, through individual and collective efforts, establishes and maintains and improves the ethical environment of the work setting and continues in conditions of employment that are conducive to safe, quality healthcare. Although the article didn't address the code specifically, it did say how nurses can combat the impact media has had, and it's all directly through our code of ethics that we can do this. Nurses are pursuing higher and higher educational levels. It's no longer enough to just have an associate's degree. A bachelor's is becoming pretty baseline. And then from there, we're getting more and more masters, more and more, not primary physicians, but more and more doctorate level educations. Nurses are getting involved with policy making in the hospitals. These magnet status hospitals, where nurses are imperative to pretty much every aspect of policy making. And nurses are even getting more political. I mean, we're out there campaigning to be able to get better recognition. For example, like with certified nurse midwives. Through campaigning, there are many, many states that now view certified nurse midwives completely autonomously. They can practice without having to be in direct supervision of physicians. And a specific point that the article mentions that kind of sums all of that up is that the general public acknowledges credentials and achievements. So the more we're out there, the more knowledge we're pursuing, the more active we're getting. The general public is going to recognize this and be like, oh, so they're not just the errand boy to the physician or the errand girl. They're not just the plaything. So yeah, I actually really enjoyed the article. It brought to light the importance that nurses have in being very vocal in fighting these stereotypes. I mean, we're directly with patients day in, day out, so we're going to have a positive impact on our image. So, whoops, hold on, sorry, hit a wrong button on here. All right, so yeah, pretty much